Afternoon, everyone. Thank you for joining today. Happy Thursday. My name is Claire Peprocki, and I am the Public Information Officer for Brown County Public Health. Before we start, it's my pleasure to share with you our guests for today. We have joining us Brown County Executive Troy Streckenbach, an update on long-term care facilities. We have Green Bay Mayor Eric Genrich with an update from the city of Green Bay. And we also have Dr. Emily Rademacher. She is a psychiatrist with Bellin Health, who will discuss the importance of mental health and the things you can do to manage stress during this time. Before we do that, though, I will run through the numbers for everyone. Today, Brown County is reporting 1,704 confirmed cases. Oneida Nation is reporting 17. For a total of 1,721. We have 44 individuals who are hospitalized. We are happy to report that we have 259 individuals who are out of isolation. We are also saddened to report our 12th death. That individual was an 86-year-old male from the zip code 54162. We know that everyone is anxious to hear the results from our community testing sites. Results do take 5 to 7 days to come in. Then after they do that, we must contact the patient to be notified of the results and begin our contact investigation. We're looking to provide an update for everyone from the testing results from those sites on Monday. 5/11. Yesterday, the Rush community test site was able to conduct 243 tests. Since last Thursday, they have a total of 2,122 tests completed. Yesterday was the first day of testing at Casa Alba. They were able to administer 207 tests. So far, with both sites since Thursday, we're happy to report that we have tested 2,329 people, which is awesome. As a reminder to the public, both sites are open until Saturday, May 16th. They will run Monday through Friday from 8 a.m. to 6 p.m., Saturday from 10 a.m. to 3 p.m., and they will be closed on Sundays. We urge the public to please schedule an appointment before showing up. You must have one symptom that's listed on our website or have a provider or employer order to be tested. We're urging everyone to follow this process to ensure that those who are ill have an opportunity to be tested. Folks can make an appointment either online or by phone. You can go to stayhealthybc.com, or if you don't have access to a computer, smartphone, or internet, you can call 211 to schedule your appointment. Drive-ups and walk-ups are welcome. If you walk up to a testing site, you still need to make an appointment. I will now turn it over to County Executive Troy Streckenbach.
Thank you, Claire, for providing us with the updated numbers. I think it's obviously we saw an increase of 69 new additional positive cases, but at the same time, we're seeing increased testing. So let's hope that that is a continued trend. And of course, saddened to see that we have another death in Brown County. And hopefully as this increased testing becomes available, our main mission was to get the testing available to Brown County. We are, of course, asking for it early on, and unfortunately the outbreak took place, and now we have the testing available. And so I really would encourage the residents of Brown County or people who come to our county to work, take advantage of this resource. It is free. It's something that you can easily just apply online or call 211. If you have one of the simplest symptoms, you're able to get tested. And this is a resource that, while we have it right now, is available through our community partnerships that are taking place. And So I would just make sure that we are maxing out. I think we have the capacity of doing roughly 900 a day. Let's make it a goal of Brown County to hit that 900 every day that we're open and operating. That should be something that we should try to pull off here in the next week and a half. It gives us a great sample of how prevalent it is in our community, and it's a resource that the Governor Evers and DHS and the National Guard have provided for Northeast Wisconsin and in particular Brown County. So let's take advantage of it while we have it here in Brown County at the community test sites. And the reality is how this is all taking place is through cooperation. As you can imagine, Brown County is dealing with many different facets, with this pandemic, whether we're addressing the community test sites, whether it's public health, the safer at home orders, guidance to our residents. There are many moving parts to this, and we wouldn't be able to do this without the cooperation of our municipalities, our private nonprofit partners, our private partners like the healthcare systems, Aurora, Bellin, and Prevea. All of this is really together as a group. We are trying to, provide the public safety for our residents in Brown County, and at the same time create an environment that allows us to be safe. Can't be said without it. The city of Green Bay has been extraordinarily helpful in terms of the providing, the resources that they've been providing Brown County in the Emergency Operations Center within our unified command. As you can imagine, the city of Green Bay, being the largest, has a significant presence with both their fire and law enforcement and expertise in managing these type of things. So collectively, as a community within our unified command, they've been extremely helpful. And to talk more about what the city has been doing and how they've been helping Brown County Health and Human Services, Public Health manage this, I'm pleased to have with us Green Bay Mayor Eric Genrich joining us. Eric?
Well, thanks, County Executive Struckenbach. I really appreciate the opportunity to join with you today. I want to echo everything that you said in terms of what we want to see from the community, taking advantage of those test sites that we have within the community here. And just want to extend my thanks to the county as a whole, the county executive himself personally, and Brown County Public Health for leading this community through a very difficult time. As you all know, Brown County Public Health is the lead agency as we move through this crisis. But as the county executive said, the city of Green Bay has been well integrated into the unified command structure. I believe we have 9 fire personnel who are a part of that structure and police personnel that are assisting with what is needed. We were happy to play a role in standing up those community test sites. That's something that the county executive has been asking for some time. We're really thankful that our Department of Health Service partners in Madison and our National Guard have been so integral and so supportive of the need that we have as a result of the outbreaks that we've seen. So very appreciative of all of those who have participated in the response. I don't think this is anything that any of us ever anticipated, and it's still a very, very concerning time for all of us in the community. To see these numbers continue to grow is not unexpected, but it's something that continues to to cause us great concern. So from my perspective as the mayor of Green Bay, just want to continue to encourage people to stay safer at home if at all possible. We really need to continue to focus on that social distancing and that physical distancing, encouraging people to continue to wash their hands, not touch their face. And when they're out and about, if they need to be out and about for essential duties, they really need to be wearing masks when they're associating with other folks in the community, because we are obviously far from out of the woods at this point. We have a lot of work to do, not just in our official capacities as governmental entities, but as a community. We need to continue to pull together by staying farther apart during this difficult time, because we need to continue to push down that curve. We've, I think, made some progress as a state, flattening that curve, but that hasn't been the case here locally because of some of the industries that have experienced those outbreaks. So we just need to continue efforts to do whatever we can as individuals and as a community to push down that curve and slow the spread of the coronavirus in Greater Green Bay. In terms of other efforts that we're engaged in, one thing that we've said internally, as in spite of what we're dealing with as a nation, state, and community with this pandemic, Green Bay goes on. So our operations have evolved pretty dramatically in recent days, but all of our critical services continue to be provided throughout the city. And we've pushed a lot of people to their homes to work remotely, to minimize the number of people that we have congregated within our buildings as a city. But people have been incredibly adaptable, and so our services continue to be accessible to citizens of Green Bay, and we encourage people to continue to reach out for whatever they might need. Specifically related to COVID-19, we were able to receive some federal dollars as a result of that first bill that went through Congress and was signed by the president, the CARES Act. And so as some might know, we were able to create a pandemic loan relief fund for businesses in the community. As a result of that federal money, we're going to be pumping an additional $100,000 into that. We've seen already some interest from Green Bay businesses, and just would encourage others who are in need of assistance and haven't been able to get that from the federal government to take a look at our loan relief fund here. Additional information is available at greenbaywi.gov/business. So if you're in a position, you're in a business that is in need of a loan, we're deferring those payments for the first 12 months. So please reach out, take a look at what's available there. In addition, I mentioned that CARES money that has come to the city of Green Bay in the form of community development block grant funding. So we're going to be having a discussion at a redevelopment authority next week, Tuesday, to further disperse those funds. I mentioned the loan program that is up and running, and will be given additional funds. But we're also going to be discussing plans to assist essential workers who have been impacted. Some of these food processing employees, meatpacking employees, others who have been impacted individually and as families. We are going to be providing assistance if that plan is approved by RDA and our council. Also planning to provide additional assistance to our business improvement districts in the city of Green Bay. They provide really critical work to our Main Street businesses, downtown, on Broadway, on Old Main, and over on. And they've been hit very hard. A lot of their revenue is dependent on events. Obviously very difficult to hold events during these times, but they provide a really, as I said, a critical service to businesses in the community, and so our plan is to assist them as well. Finally, we are hoping to establish a Green Bay Conservation Corps as a way to employ individuals who are unemployed as a result of the coronavirus. We'd obviously love access to more resources to put more people back to work, but there are a lot of things that we can be doing to beautify the community, to improve our parks and other resources here. So that's another element of our plan that we'll be bringing forward to the RDA on Tuesday, and then to our council subsequently. Just wanted to close again by expressing my thanks to Brown County Health, to the county as a whole, to County Executive Streckenbach for the work that they have done, as I said, to lead us through this health crisis. We stand ready and willing to do whatever is necessary to support them in that work, to support our community, because this is a situation that requires all of us to do absolutely everything we can to get through this. And I know that we will. We've been through challenging times as a community and as a nation before, and we've always pulled through. And I have no doubt that we will emerge stronger on the other side of this. But these are difficult times, and it's incumbent upon us to acknowledge that fact and recognize that a lot of people are struggling economically, psychologically, But we're going to emerge stronger, and I'm confident of that. So thanks to the county executive for asking me to join you today. Thanks to Ms. Paprocki for hosting us, and I'll turn it back over to her.
Thank you, Mayor Genrich. I appreciate the opportunity for you to come on and just briefly give people an update on what the city is doing in terms of, working on different programs that are going to be available for the community members, businesses. I'm glad to see that the city council is, is looking for solutions that can help both the businesses and the residents of the city of Green Bay. One of the greatest challenges of this pandemic is obviously the separation from loved ones. That's even more true as we have family members who are in long-term care facilities or nursing homes. As you're aware, the governor recently ordered testing at all the long-term care facilities in the state. We have received information from the State Department of the Human Health Services outlining what that will look like. The test will include both residents and staff. DHS is overseeing the testing, and we are told that starting tomorrow, May 8th, they will be posting facility-wide investigations by county on the DHS website. We have also been told the information will be broken down by the names of the skilled nursing facilities that have at one of the COVID-19 in a resident or a staff member. For family with members staying at one of these facilities, it's important to know the following. Medicare and Medicaid require facilities to notify residents, approved family members, and employees of the testing results. If you have a concern, family member can contact DHS, Department of Quality Assurance, to find out more. We know that these are trying times, and it's important for all of us to work to maintain not only our physical health, but equally important, our mental health. It's been noted that roughly on the federal emergency hotline for people in emotional distress registered more than 1,000% increase in April compared to the same time last year. In April, roughly 20,000 people texted the hotline, which is ran by Substance Abuse and Mental Health Services Administration. As we know, isolation does create loss of job. These are all mental health issues that impact all of us. It's important for us to be making sure that we're reaching out to individuals and just finding out how people are doing. At the same time, we're pleased to have with us to talk more about mental health Dr. Emily Rademacher. She is a psychiatrist with Bellin Health in the Bellin Psychiatric Center. Dr. Rademacher?
Hi, everybody. Thank you so much for having me. Is the audio okay?
It is.
Great. Mental health is such an important topic all the time, but even more so now in light of everything that's going on. So I really appreciate you having me, giving me an opportunity to speak to this today. In my office, in my practice, and in talking with colleagues around the country, we're seeing a lot of different kind of trends and types of concerns that people are struggling with. And what you mentioned is probably the biggest, and that's the social isolation piece. We're social beings by nature. That's just kind of, that's what we are. And this goes against, our very nature, and it can be incredibly difficult for people. Even my patients that are terrified to go out in public typically are struggling with the inability to be able to go out in public and be around people. So it's an interesting thing. As you mentioned also, the nursing home population is really struggling now because they aren't able to see their loved ones in person. They aren't able to dine with other people that they live with, and it's been really difficult for them. So I echo what you said in terms of reaching out and trying to touch base as often as possible with these people. People that are ill and that are in the hospital are also having to be alone, not having visitors and people with them when they're having procedures done or scary, illnesses and things. And so that is also causing, significant increase in anxiety and some depressive symptoms. even, the grieving process, if someone loses a loved one during this time, you don't have the ability to be with family and to mourn that loss together. And that's kind of takes a little bit out of the humanity out of kind of some of that difficult things that we usually lean on others for to get through. But also there's a lot of uncertainty about the future. And I think that leads to a lot of anxiety for people, wondering what is it going to be like when this, is over? Is it ever going to be over? What is this all going to look like? But also the frequent changing information and guidelines that we're all getting all the time, I think can cause a lot of anxiety and uncertainty for people too here. And we've all been through this the last month and a half. You hear something at 8 o'clock in the morning, and then by 5 p.m. it's different. And that's no one's fault. It just is what it is when you're dealing with something like this. But it can cause a lot of uncertainty and a lot of anxiety for people. But also, lots of financial struggles, as you mentioned. Am I going to be able to go back to work? How am I going to feed my kids now that they're home and they're not in school all the time? So food insecurities, financial struggles and stressors. Obviously, business owners really struggling with, again, the uncertainty of what this is all going to look like. Can they sustain through however long this is going to be? People that are having to work more than usual, some of the hospital employees, or having to work in different roles than they are actually accustomed to, taking a physician that hasn't worked in an ICU in a decade and getting them ready and prepped to be able to do that if needed, I think is there's lots of different ways that this situation is causing stress and anxiety and kind of mental discomfort for people. And then, you have the people trying to work from home while their kids are trying to do school from home, or they are having to work outside of the home, but also homeschool their children. There's lots of different ways that this is affecting people. So there are some things that we can do as individuals to try to help mitigate some of these stressors that come with. Obviously, we can't make it go away. We would if we could, but there are some things that we can do that are fairly, simple and easy, so to speak, to try to make things a little bit more manageable. Probably the main one for people, even those people that aren't working now or aren't in school now, is sticking to a schedule. So getting out of bed, taking a shower, putting on real pants, putting on makeup or drying your hair, or putting on clothes as if you were getting ready to go to work or go to school, just to get your brain back in that mindset. Otherwise, staying in your pajama pants, sweatpants, it's like a perpetual Saturday for months at a time, and that is going to lead to people feeling more depressed. Trying to remain as connected as you can with others, and obviously, we have limited ability to do that. However, people are getting creative, and I think it's really a wonderful thing to try to reach out as much as you can to people in your community, people in your neighborhood, people in your family, but also doing good for others if you can. If you can do something to help another person, that really can help kind of balance out some of the negative emotions you may be feeling. So something like, checking in on an elderly neighbor that may or may not have someone to help her get groceries, or obviously in a safe way, but doing those sorts of things, or providing, cookies for the first responders or something like that, just to help kind of share some of that goodwill can really go a long way to helping other people, but also improving your own morale. Gratitude is a great, simple, easy way to improve your positivity, and that's just as simple as taking a couple seconds each day to think about something that you might be grateful for despite everything that's going on. Maybe you're grateful that you still have a job, or you're grateful that it's not snowing anymore, or whatever it is. Something just that simple can really change some of that mindset and create a sense of positivity and hope. Trying to stay as active as possible, walking around the block, doing sit-ups in your living room, trying to get outside as much as possible. Those are all things that can really be helpful in terms of maintaining mental health. But also eating well, the kind of the basic stuff, eat well, get enough sleep, don't neglect your own needs, mental or physically, get your health care. Don't put that off. Try to get that in any way that you can if it's needed. If health systems in the area are doing a lot of really interesting kind of forward-thinking things in order to be able to continue to provide care in a safe way to our patients. But also then, if you do feel like you're struggling, knowing that it's okay to reach out. And in just a minute, I'll give you a little bit more on that. You know, it's expected that people will feel potentially more anxious, a little bit down, concerned, stressed during this time. So when is it too much? I think that's the question a lot of people have, like, when do I need help? When is this, what's normal and when is it that I need to get help? So the big thing is, obviously, if you're having thoughts of wanting to harm yourself or wanting to die, wishing that you were dead, feeling hopeless, like losing that sense that things are ever going to get better, feeling that people will be better off without you or that you're a burden to people, not sleeping well for a week or more at a time, or sleeping way more than normal, a week or more at a time, decreased appetite, feeling a lot more anxious and unsettled. Those are all clues that you may want to reach out for some help. So if you are having suicidal thoughts, the suicide hotline that you mentioned would be a great place to start. It's 1-800-273-8255. But also then here in Brown County, the Brown County Crisis Center is also available 24 hours a day, and that's 920-436-8888. But also then 911 is, if you don't know who else to call and you're really struggling, that's an okay thing to do too. If it's a little bit less urgent, you could certainly call your primary care doctor's office. That's a great place to get started. They can do a lot of mental health treatment for us. I always say that they're kind of honorary psychiatrists in a lot of ways. So they can start that process. They can help get a referral placed if necessary. But then also you could call your health system's nursing line if you don't have a primary care doctor or if it's after hours. And at Bellin, it's 920-445-4343. Some community resources. Obviously, there's a Family Service Crisis Center in Green Bay. There's a really great website called Connections for Mental Wellness, and that's connectionsmw.org. And that is a really great place to find all the resources that are available in the area, kind of in one location. There's a lot of great resources and information there. But also Brown County 211 is a great place. Additionally, if you are on Facebook or Instagram, checking out Keep On Wisconsin's Facebook page or Instagram account, they have lots of really uplifting, happy, positive examples of how people are trying to get through this time. And that can be a really nice place to turn to see how people are sort of finding creative ways to keep up the positivity and try to maintain their mental health during this time. So that is all I have. Thank you for having me again.
Thank you, Dr. Emily. We will now open it up for questions. I am going to ask that before asking your question, if you could just identify yourself by name and media outlet, and then you can direct your question to any one of the four of us.
Rob Sussman, WTAQ. My question is regarding the number of people in the hospital. Do you have a specific number as to how many of those people are in the ICU?
No, not at this time. I think that the health systems would be able to provide that information to you.
Hi, Ben Crumholz, Fox 11. This is for Mayor Genrich. Do you know the total amounts that the city received from the CARES? And do you have a breakdown for how much will be given to help essential workers, how much to help the business improvement districts and the Conservation Corps?
Yeah, thanks for the question, Ben. The total number, I believe, is $595,000 that we received in community development block grant funding. I don't have that total breakdown in front of us, but that will be provided. My understanding, that will be provided when the packet goes out for RDA tomorrow.
Hey, Doug Schneider from the Press Gazette. For Claire, did we ever see any sort of spike or bump in cases related to the election night concerns? It seems like we're sort of at a point now where if we would have seen, if they were going to occur, we would have seen them.
Yeah, Thanks for that, Doug. Fortunately, we have not seen a spike or a cluster of cases related to the election.
John Duran with WLUK. I think this would be for Claire. How are people getting their results? Is it a phone call? Is it a letter in the mail? The COVID-19 testing results, and is it the same for people who went to one of the community testing sites as it would be for testing that happened at one of the, for an employee at one of the meatpacking plants?
Yep, so the results work just like any patient care. So the provider would be following up with that individual, usually via phone call. And the same goes for the testing sites. I can't speak for each employer group who's doing testing, so I would direct those questions directly to that individual facility. But for the community testing sites, our healthcare systems are the one that are entering in that data and then following up with the provider. They would then turn that over to public health so we could begin contact tracing.
Rob Sussman from WLUK again. My question is, have there been anything put together? Has there been anything put together regarding what businesses should do once the state begins to reopen and once the economy starts to get moving again?
So Brown County is obviously in the process of working on a planning guide that would be helpful for businesses that we particularly license, or we have some ability to help show them the guidelines that are being prepared by either the state or the federal government. So we will be actually bringing that out and discussing that more next week. And so we're in the process of it. I would say that, in our conversations and reaching out with many of the different associations, there are, currently discussions amongst those statewide or national associations to really kind of start to discuss what are the customer expectations so that when they do come in, we want to make sure that they feel safe. What are employers doing to make sure that their employees are safe? What procedures and protocols do they need to implement? As you're probably aware, there's so many different industries, whether it's the retail, the commercial side, and the retail side. You have your food establishments, your entertainment establishments. So there's a lot of different aspects that are hopefully, in contact with their associations and working on best practices. And then, of course, the CDC through the state and the federal government, and locally, we will have, our own guidelines that are going to be required as the state, begins the process of reopening. And so we're going to be discussing that a little bit more in detail next week, and we'll have some people on to talk about it.
Ben Crumholz from Fox 11 again. This is for the county. Psalm Partners put out an email for all employees last week for mandatory testing. And under who it says all partners that have not yet been tested, all partners that are in quarantine. Was the county aware of this? And is it acceptable to have quarantined people come in for testing as long as they're being socially distant 6 feet apart?
So I can't speak to an email that may or may have been sent out. I would, again, direct that question directly to Mary Schmidt, who's working with Psalm Partners, to ask about their, what emails they sent out. From our understanding, Psalm Partners is following the guidelines set forth by the CDC. And we have verified with Psalm Partners that if an individual is on quarantine, meaning they were diagnosed with COVID, they are recovering, they're not required to come to work.
But is it okay for a quarantined employee to come in and be tested?
To my understanding, Psalm Partners is not doing that.
Would it be okay for any company to do that, though?
The recommendation set forth by the CDC is after that period of the 14 days, or if you're symptomatic free, for I believe it's 7 days. The CDC guidelines are pretty clear, Ben. I can send those to you if you need them. And facilities are following that if someone is diagnosed with COVID-19.
Hi, this is Addie Bink from WFRV. Claire, I don't know if you could speak at all to this, but we've gotten reports that a Walgreens in Green Bay was closed and there were people with hazmat suits going in. I don't know if you've heard of that at all, if the county knows anything, if they've shut down or anything like that.
I have not heard that. So I wouldn't be able to speak to that. I'm sorry. Any other questions for County Executive Troy Streckenbach, Mayor Eric Genrich, Dr. Emily, or myself? All right. Thank you very much, everyone, for joining. Have a good day.
Thank you.